Dr. James Rota, and as you can see, I'm bouncing. I'm bouncing on what is referred to as a rebounder. And it was the rebounder that basically introduced me initially to the concept of bouncercising, which I'll explain in a moment. But it was my effort to address a mercury toxicity that I was dealing with personally and professionally. I, being a dentist, having put much mercury fillings into people's mouth and taking it out, I became contaminated personally, as was diagnosed by the new conventional methods of dissection. Nonetheless, I got the symptoms of mercury toxicity, and when I began to investigate with the assistance and an association and collaboration of a physician, and we went to various courses, and they all kind of looked at mercury toxicity as a real problem that required some diligence on detoxification, knowing what organs it has affected and where it was hiding, and why we've had a hard time diagnosing mercury toxicity, because it hangs around in the fat and it's harder to detect by conventional blood testing methods. Therefore, mercury toxicity methods of detection have to be relied on a challenging method, a utilization of a sulfur agent that challenges, which is the term that is applied to diagnose mercury toxicity, by the use of a challenging agents like a sulfur agents. DMPS was one of the popular agents used in the early days by other countries to pull out the mercury toxicity residing in the fat and getting it out of the body through the conventional means, the urination and the BMs. So again, this became a concern in many areas, obviously, but personally, because I was affected professionally, I was highly mercury toxic, and of course you don't use the test. You really wait until the symptoms occur, and I had severe symptoms, and then we became aware of the concept of detection. And once I realized that my detection methods revealed a lot of mercury in my body, I proceeded to find ways of detoxifying it. So that's where we are, is methods of detoxifying, getting the mercury out of the body. We pretty much are establishing that mercury is in our day-to-day life in many ways other than implanted in our body. And obviously we're utilizing it commercially in a number of products, so we're not necessarily excited about accepting the responsibility globally of dealing with this method of insidious destruction of our health and our welfare, for that matter. So nonetheless, how you personally deal with it, and those of us that are realizing the relationship of mercury toxicity and the effect of the body, have realized that circulation is an important part of detoxification. Increasing circulation, hydration, giving yourself adequate intake of water, half your body weight in ounces per day is a general tool. That means you got to drink a lot of water to facilitate the release of these toxins. Then you could encourage, of course, the toxins to go out of the body by using certain binding agents and replacing dead cells and cells that are being manufactured by nutrients. So it's a combination of nutritional awareness and the release of the toxins, and methods that you can release the toxins. Once you begin to understand detoxification as a word used to describe getting rid of the toxins, you would have to realize that circulation is vital in removing these toxins, getting the toxins out of the cell and getting the nutrients into the cell. Facilitation of circulation can be established by movement that activates a system in our body that facilitates this communication between the nutrients going in and the toxins coming out by way of the blood vessels, and that's the lymphatic system. Now, the lymphatic system has no pump, so it relies on movement, circulation. So therefore, we're looking at bouncercising as a major method and determining an activation of that cells.